اوكي طيب I can't hear صراحة بس محمد يقول لي okay the questions will be through Q&A box. Okay طيب sure. أنا حصل عبد السلام, just a brief about me. I'm BGY2 from King Saud University from Riyadh. I'll be talking about the neurosurgery program here in in Riyadh in general, because in Riyadh here we have a joint program. So just an outline about our presentations. I'll start with an overview about the specialty of neurosurgery, and then I'll talk about where do we stand compared to the North American programs, and then I'll give you an overview about our current program, and then I'll give you some tips and tricks on how to increase your chances for acceptance as a student and then as an intern. And then I'll give you a tips to succeed as a resident, and then we'll do the conclusion and remarks, and then we'll do the Q&A. So just an overview about neurosurgery. I'm sure like anyone here joining us is already interested in neurosurgery, and you know about the specialty, you know about the subspecialty, you know everything. But just one thing that I would like to mention about neurosurgery, you have to put in mind like that is neurosurgery is very physically demanding and is mentally challenging. And it's not that one of the specialty that has high reward or satisfactory outcome for all patients. So you have to put that in mind before going into neurosurgery. So if you're not really truly passionate about neurosurgery, I think you should just run away as far as you can from neurosurgery. Because as I mentioned, it's a very demanding specialty. And then for the students and interns who are interested and they're not really sure whether neurosurgery is for them or not, what I advise for them is to actually take as many elective rotations as they can as a students and as an interns, just to explore the specialty and to know more about it before going into neurosurgery. So just an overview about the local program here in Saudi Arabia. When I say in Saudi Arabia, I'll speak mainly about our joint program in Riyadh. I'm not really sure familiar with the joint program in Jeddah or in Dammam, but I'm sure there was any. If you are from Jeddah or Dammam or something like that, just contact me later on, and they can just hook you up and with someone who from the Jeddah program or the Dammam program, you can speak to them. So our program is a 6-year program. So I advise you, it's like I'll speak briefly about that, but I also advise you to go and read in the Saudi Board Neurosurgery Curriculum Manual. If you want this manual, you can just scan the QR box here, and then you will have the manual. So Riyadh's joint program has 6 main training hospitals, which is the King Saud University Medical City, which is where I am from. And then we have KSUMSC, we have the military hospitals, and we have Ashmesi, and then we have the National Guard, and we have the Takhassusi, and then we have Prince Mohammed bin Abdulaziz, which is I don't think it's part of our training program, but actually they accept 1 residence per rotation. Then the program structured for junior years and then senior years. In your junior years, which is from BGY 1 up till BGY, this is 3, not 2, sorry, up till to BGY 3. And then after that, you can take your part 1. So you can take your part 1 either as a BGY 1, BGY 2, or BGY 3. And this part 1 will actually, when you pass part 1, you can be like promoted as a senior resident. And then you, in senior years, is from BGY 4 up till BGY 6. And then you'll have your final exams and you'll be a specialist or a neurosurgeon. So we have promotion exams each year, like at the end of each year, it's usually at the end of August. And then in each rotations, we have the ITER, which is the evaluations for your rotations, like the whole rotations for 3 months. Then we have the DOBS and the logbook, where we actually track our surgical cases. I just wanted to shed a light of where do we stand compared to the North American programs. I'll speak mainly about the US program and the Canadian programs. So there are 2 components actually of when you compare a program here or abroad, like most people, not most people, like some people actually are more drawn to the North American programs because they have higher surgical load, and the other components, which they have better research facilities and better research supports if you are interested in research. So just the research part, we'll talk about it later, but for the surgical load or the higher surgical loads, so in the North America and the United States, they have actually they have some statistics where they collected the number of cases of all residents that is done per residency, like the whole residency. And they did the statistics in each year. So in the year of 2018, 2019, in the registry, they found that on average, like each residence graduates with a number of cases. These cases are for the whole residency, with around 1,559, which is a very high number and a very good number. That's on average. And then they have a set of criteria that you don't graduate unless you qualify, or unless you did the minimum number of cases, or the minimum number of the surgical cases. And they have actually definitions for these cases. They have the senior and the lead cases, and that's the cases where you start from the beginning, like from the opening up till the closure. And then we have the lead cases, and the lead cases is different. They have some like definitions, like working under the microscope. So the minimum requirements for them is 800 per residency. That's the minimum for the senior and the lead cases. And then the lead cases is 400. So I know I spoke about this in details, but we'll go back to that once we talk about our program and compare it to that. And then we have the Canadian programs. The Canadian programs comes after the United States program, or at least the average of the United States program. I found this article which talks about the operative landscape at the Canadian Neurosurgery Residency program. And they actually came up with an index. The study actually took place for 1 year, which is from January 2014 up till December 2014. And then they collected the cases, and then they calculated an index, which is the index of the cases per year. And the index was 186. So if you multiply this 186 by 6 years, this gives you a 1,116 per residency. So that's the calculated of the OR cases they do per residency. And of course, this is just an estimations for the Canadians, because in the paper actually they spoke that the index, because of their method, the index it was actually underestimating some of the programs. So let's go back to our program. So my calculated, I know, like if you go into the manual that I put like in a few slides before this, you would say you'd find like there is minimal requirements and expectations of the number of cases that our residents do in each year. But I don't think it's really realistic. So I just want to give you my realistic opinion from my personal experience. So this number is from my personal experience. So my calculated rate on average, that is the cases that I expect to do from BGY1 to BGY4. So I calculated my average. I'm a BGY2, so I'm an R2. So I calculated my average on the number of cases that I did per rotations in R1 and R2. And the average was 36 cases per rotation. So of course, the rotations that we have is each 3 months, we have 1 rotations. And then I expect myself in BGY5 and BGY6 to have approximately 72 cases per rotations, because actually usually the senior get more cases here because of the arrangements of the teams. Like the teams usually have many juniors and 1 senior. So if we continue to progress as this, I expect myself to have 72 cases per rotations. So that is a total of 936 per total residency, which is actually, even though it's lower than the Canadian and the North American, but actually it's qualified based on the criteria for graduation in North America or in America. It's actually higher than the minimum requirements. So now spoke about about our program. So I'll move on to how to increase your chances in your acceptance. Now you know that you want the local program. You're convinced that the local program is a good program. So what can you do as a student, as an intern, to increase your chances of your getting accepted or being matched? So as a student, I encourage you, all of you, like if you're interested in neurosurgery, I encourage that you take, as I said, take as much electives as you can. Taking electives will let you actually explore your options, explore if the neurosurgery is for you or not, and also it will you will become a familiar face once they see you. Like they see you in this hospital, then they see you in other rotations. You will become a very familiar face for them. And then I encourage you to attend the grand rounds. Like if you are like, for me, I'm a KSU graduate, so I used to attend the grand rounds like every grand rounds in our hospital with the department. This helped me to become a very familiar face to the department, actually. And then I encourage you also to do research, neurosurgical research. If you are like very new to the research, you don't know how to conduct research or something like that, I encourage you to start with case reports. This will actually build your skills on how to write and how to conduct researches, and like to also build your publications and your CV. Writing is a skill, so you can start with the case reports and then progress from there, then case series, and then you progress for large research projects. And then as a student, if you take an electives, I encourage you always take one step ahead. Like if you are a student, act as an intern. If you're an intern, act as an R1. That later on, if you're an R1, you can act as a senior. Then as a student, what you can do is to present at the SANS meeting, like if you have a case series that you did or something like that. This will help you to become a familiar face, as I mentioned before, and they will know your name at least. And then I encourage you to actually learn new skills and learn beyond your level. Always, as I mentioned, always be a learner and be better than your level. Like if always one step ahead. And then I encourage you as a student from early on. I know some people say it's very early, but from early on, try to find a mentor. Actually, the Neurosurgery Society is a very small society, so you can find like mentors, like whether it is at your institution or other institutions. Like for example, you don't necessarily, like if you're a KSU student, you don't necessarily like to build your mentors has to be in KSU. You can like find mentors at KFMC or any other hospitals. Just generally persistence and time management as students, these are key for you to actually succeed as a student. And then as an intern, what I encourage you to do is to take neurosurgery rotation as much as you can. Like this will help you a lot. Like you cannot imagine how much this will help you. For me, I did 6 months in my internship. Actually I did first at the end of my 5th year. I did one neurosurgical rotation. It was in Toronto, and then I did 3 months here in Saudi. I did in KSU, and then I did in KFMC, and then I did in the National Guard. Then I went back to Canada, and when I took one elective in Dalhousie and then one elective in Montreal. So you can see how obsessive I am. So if you want neurosurgery, you always have to be very passionate and very obsessive about it. And then while in each rotation that you have neurosurgery rotation, I advise you to take as much calls as you can. Like even if they give you one call, try to come try to cover 7 calls. And for me, I used to come each weekend, whether I'm on call or not, because usually the residents, they need some help during the on-calls during the weekends, because there's just only one person covering all the surface, so you can just help out with the notes and everything. And of course, when you are working with the residents, as I mentioned here, be the right hand of the residents, especially if it is the on-call residents on the day, or like on the on-call residents each day and the chief residents. And I know that the residents, they don't have much of a say in the acceptance, but I'll tell you that the residents talk. And even if you think that you are invisible to the residents or invisible to anyone, believe me, you are always being watched. And neurosurgery is a very, very, very small society, very small community. So if you did good in one hospital, believe me, everyone will know about you. If you did very bad, believe me, everyone will know about you. And then as an intern, like if you did not do research as a student, you can start doing research as an intern, but like you have to be careful. Don't overwhelm yourself with research as an intern. because during internship you have much more important things to focus on, such as the exam, which is the SMLE, which brings us to this point, which is the most important point. And I cannot stress enough how much the exam is very important. Like your score in the exam is very important. Like neurosurgery is becoming competitive year by year. Like in my year, they only nominated 8, and out of these 8, they accepted 6 in Riyadh, in whole Riyadh. Like each center accepted 1 resident. So you have to put in mind it's a highly competitive. It's becoming higher and higher each year. So you have to get like a very good score in the SMLE, spend some time, study, whatever you have. And for me, honestly, I depended mainly on my like knowledge from mid school, but to start with, my knowledge in mid school were good. Like if you think that you're lacking knowledge or something like that, you have to prepare very well for the exam, because I know a lot of students, they were extremely passionate. They did the rotations, they had good CVs and everything, but at the end, the SMLE, they didn't get good score in SMLE, and then they did not, yeah, they didn't get nominated. So just be careful with that. Then, as I mentioned, as an intern, always work as an R1. Like even if you take calls and everything, work as an R1. It's like you will be under the supervision of the residents, but like try it like to step up your game actually. And then, as an intern, like one thing that you should do is just to network beyond your institution. I think this is a mistake that I did. Like most of my work, actually, I was concentrating on the KSU, the King Saud University department. So so always like explore your option, expand your options. If you can just network beyond the institutes, goes to other hospitals, different hospitals, work really hard in all hospitals, that would be amazing. Like it will increase your chances. So this is just photos just I wanted to share with you. This is the first, here, this image, this is the first science meeting that I have attended. And I think, yeah, I cannot stress enough that attending the science meeting is very important. It will let you network with everyone. Like you'll see a lot of people, and if you can present that, that would be extremely useful for you. You will be a familiar face. They will know your name. They actually, they will remember you, believe me. And then this is just a text that I texted my mentor, Dr. Adlan, before going to my serious hands-on, like my first serious hands-on elective, which was in Toronto, neurosurgery returns. I told him like to give me some tips, and this is, it's an extremely good advice, honestly. He said, go early, leave late, talk when they ask you, hunt for a project, maybe case report. And I took these words literally, and even I published a case report with them. And then, so, but these are good advices. Like always go early, be the first person to step in the hospital and in the team as an intern, and then be the last one to leave. This is like this picture actually with Dr. Ed Benzel. I think he's very famous. Anyone who's interested in neurosurgery, I think he knows him. And that's one thing about the perks of neurosurgery. Like if you go there, you'll network with international people. So last, for the tips, as a student or as an intern, always appreciate and enjoy the experience. Like I cannot stress that enough. So then we'll move on to I'll talk about the daily workloads as a resident. So as a resident in neurosurgery it's like military, honestly. Like you come in really early, and then you leave really late. And usually the rounds, it's very early. It's starts at 6:30, like at least in my institute. And then the ORs, you have to take in mind that the ORs are usually long. So these long hours of standing and working, as I mentioned, it's very physically demanding. And then the on-calls, like typically actually in Riyadh, you take around 7 to 8 calls per month as an R1. And then from R3, R4, like the on-calls start to decrease. You take like 6, 7, sometimes some institutes 5, and then R5, R6, like you become as the calls you take is usually as second on call. So, and there is a junior with you. So this is just tips to succeed as a resident. So once you get accepted into the program, Just some tips. I took this from actually Dr. Luton from the Neurological Barrow Institutes in the United States. This is from a neurosurgery podcast. So as a resident to actually succeed, the first step is to actually know your anatomy, know the landscapes, because the best surgeons uh, are the ones who love their anatomy. And then the second tip is the pathology or the clinical loads. You have to see a lot of cases. Like in order for you to succeed in any case, you have to see as many cases as you can, like a lot of meningiomas, a lot of AVMs, and so on. Then the third is the dexterity. It's actually dexterity in neurosurgery, like it is very critical, but it's not everything. Like to succeed as a resident, it's a component. It's a component of each and everything. And the best residents are the one who actually succeed in all components. So the second tip is the observation and mentorship, or the inspirational sides. You have to be driven. In order for you to be a good resident, you don't like all good residents don't seem to get bored. Like they're always passionate. They're always hunting for something else. And I'll quote Dr. Luton when he says that being in a place where you have actually great mentors, you have huge volume, you stay engaged over a long period of time, that will let you succeed as a resident. And then for me, from a personal experience, and I really liked KSU, like our centers, we have huge volumes and we have great mentors. So that's why I was very driven to our division. And then the fifth tip is the personal reflection. So each or every case that you see, you have to reflect on what you have learned from it. Have a log or a long-term log, write something that's meaningful that you have learned for each case. They're actually I remember like when I was in R1, I used to cover consultations for 4 months. And Dr. Ajnan, I think when I first met Dr. Ajnan, he told me that he used to keep his paper, like a copy of all the consultations that he did as an R1. So I kind of did the same, and it's really, really amazing, honestly. Like each case that I read about it, I almost have something. Like when I read, for example, for مثلا AVMs, like or dural AVF, like a dural AVF, I also have a case that I already seen. I could just open the computer and log, just put the MRI and see the images and everything and learn from the case. Then you have to push your boundaries. Always meet the new challenge. Try to find next challenge. Like you have to be very driven and very passionate. And then the seventh tip is the innovation. Try to find a will and a passion for it. Even from a from younger years as an R1, R2, just try to find something that you're really passionate about and navigate through it. And then Dr. Luton concludes with the pen is mightier than the scalpel, which is like you have to take your experience and turn it to something that is truly meaningful by connecting to the bigger audience, and that is by publishing. And which brings us to the last step, which is like if you are really interested in research and you want to pursue neurosurgery, that's me actually. One thing that you have to consider, like our program compared to the abroad programs, the North American mainly, actually the research here is really lacking. We don't have like proper like good funds, and we don't have like well established research labs, and we don't have researcher scientists, and we don't have neurosurgeon scientists who holds a PhD. So this is all taking in considerations, but actually we are actually progressing day by day, and inshallah you'll see some changes bismillah. So just general tips. Uh, just quit coffee, avoid tobacco, exercise and practice endurance, sleep very well, meditate in the morning. Don't forget to take care of yourself in all aspects. I stress on this point. You have to take care of your physical health, mental wellness, and social. And this is actually from my personal experience, because if you actually neglect your physical health, mental wellness, and your social aspects, it will backfire like really bad. So you have to take care of yourself. So this is just a picture from yesterday, actually, while I was doing this presentation for you guys. Then last but not least, get yourself up to the mountain. Good luck. You can contact me here in my email or my WhatsApp, or you can just call me. This is my Twitter. Actually, I'm very كل شيء حطوا like in the Twitter. It's all about neurosurgery, so I'm very obsessive. And then this is actually the Saudi Arabian Neurosurgical Research Network. This is a network that I have established from all over, like from 5 cities across all over Saudi Arabia, and we're actually in the process of publishing our two research work, and we're actually planning to do some more research but we were bounded by the COVID. But inshallah, with time, inshallah, we'll resume the research. And if you are interested actually to join us, just look at our website and just contact me. Let me know that you're interested. I'll get you some like good opportunity to participate with us. So now I'll move on to the Q&A. But I cannot hear you. I don't know why. So if you have a question, just write it in the Q&A and I'll answer you. So we have Hamoud, how to decide between neurosurgery and neurology. Actually, neurosurgery is like, it's I did three months of neurology as an R1, which was mandatory. I think neurology is let's say from like as a theoretically is close to neurosurgery, but practically is totally different. Like we have the surgical part, like neurosurgery, part of our work is not part, like the majority of our work is surgery. So what I advise you is just to take electives, like during your internship, take two neurology electives, two neurosurgery electives, and I'll think you'll know how to decide, and you yourself, you'll decide. And then we have Saja. She said average enter on call. Well, it depends actually on each center. Like I remember KFMC, they gave me like 3 on-calls, I think, 3 on-calls a month. Like in King Saud University here, we actually give the interns on-calls, but the on-calls cover the whole surgical specialty. So you cover everything. So that was not really useful, but they give you one or two. But for me, as I mentioned for you, like if you're really interested, you have to show them how passionate you are, take as many calls as you can. So for me, when I did my rotations, I used to take like 7 on-calls, but like it was crazy. Like I'm very obsessive, but you have to be obsessive in order for you to actually shine. That's it. So and then we have Zahra. How did you take elective in Canada? What is the process and the way? So and I know a lot because I went there many centers. So you can just send me an email or just contact me in WhatsApp. I'll let you know about the process and everything. And you said, so can I attend the conference without having something to present? Yes, of course. The conference itself is a great way to actually network. You don't have to present. I just said like it is better to present just to show your face, but it's okay. Like if you can go and attend, speak as many consultants as you can, as many residents as you can. And then you said, does summer training consider to be elective? Because you mentioned that you have done it after your 5th year. Yeah, you can do summer training. Actually, for me, and during summer, I used to do observership in the United States. So I never did electives here other than the mandatory electives when I was a student. But I think it's okay. I remember like one of my colleagues, she did a summer elective in KFMC, and that's counted. Like you can put it in your CV later on. بعدين أدنى درجة للقبول بالسنة أو العام. Actually أنا I graduated السنة اللي قبلها. السنة اللي فاتت I'm not really sure صراحة. This year it's not really announced. وبعدين على سنتي أعتقد it was 97. لا sorry 79. Yeah, I think it was 79 in my year. بس السنة اللي قبلها ما أعرف، بس I think it's announced. If you go اسأل عنها, I think it's announced. بس يعني the thing is ترى يعني year by year they're reducing the number of seats. على سنتي كان 6 بس السنة اللي بعدها قالوا إنه they were reduced بس they didn't, they accepted 8 وبعدين السنة هذه I think they're accepting 6 as well. so just be careful يعني. That's it. And then do عندنا ملاك كاتبة do the COVID situation. We are going to lose a lot of important training opportunities. So what do you think we should do? Any advice? Actually, I really wanted, المشكلة إنه I didn't start doing the presentation up till later on. I finalized the presentation. I really wanted to do some tips about how to increase your chances during the COVID time. But I didn't really have time to actually finalize it. But since you asked Malak, just contact me on my email or WhatsApp, and then inshallah I can help you out with that. And then we have Ragad Salim, doctor. I heard the rumor that they will separate spine surgery in the future. Is that true? No, actually, no. No. يعني the only thing that's يعني كل أحد يسمع this rumors إنه the joint program is breaking. They have actually discussed it last year, but it didn't happen. We're still a joint program. But the spine surgery thing, no, it's not true. Okay, so we have then this is just a phone number. Says, does neurosurgery affect daily life after, as they said? Well, actually, it depends on you, but like for you, عشان كذا كنت أقول لكم, you have to be truly passionate about. I think neurosurgery is actually a lifestyle. يعني you can imagine that يعني in regular days, not in the COVID days. In regular days, I come every single day at 6:30. And then if we have an OR, usually if it's a long OR, maybe we'll finish at 8 p.m., sometimes at 10, sometimes like, for example, 2 days in the last rotations, we actually finished the next day at 6 a.m. So you can imagine like, this is like, it will be your lifestyle, like neurosurgery would be lifestyle. So you have to be truly passionate about it. So in order for you to actually live or sustain the heavy work or the heavy load of neurosurgery. Yeah, and somehow it does affect your daily life, but it does not limit like your social aspects or something like that. If you know how to manage your time, you will do everything. Inshallah, you'll succeed as residents, you'll have a good social life. So then next we have Wissam. She says, how is the lifestyle in neurosurgery, especially if you were married? Okay, so I became recently interested in the women in neurosurgery. Like it's a very common, it's a very hot topic. I can speak, I don't think the scope of this presentations is far away from talking about this, but Wissam, okay, I'm going to expect your email. Just send me an email I'll let you know about this. أنا صراحة I always encourage females to go into neurosurgery, and then we have successful examples. We have successful residents who are happily married and they have kids and everything. But if you want just more things, just contact me and I'll let you know. And Wissam, I'll remember you. Please contact me. Okay, and then next we have Riham. How can I manage the time to have multiple rotations here or abroad in my internship? In my college, we are only offered 2 electives. Okay, so what I did, إحنا جامعتنا, they give us surgery rotations. The surgery rotations, if you take it here, the neurosurgery عندنا كان subdivision of neurosurgery. So you that's by itself is neurosurgery. For me, I did not do any GS in my rotations. So I did both surgical rotations were neurosurgery. And then we have 2 electives. So that's total of 4. And then we have the one from 5th year. أخذته, that's total of the 5th. وبعدين في واحد أخذته, that was an extra. Actually أخذت إجازة. I managed إني أخذ إجازة من last rotation, وبعدين إجازة بداية rotations, وبعدين أنا صراحة اتأخرت تقريبا في أسبوع أو أسبوعين. ما كانت إجازة بالنسبة لي, بس اتأخرت فيها لأني كنت رايحة elective. بس إنه I spoke to one of the consultants اللي أنا اشتغلت معه, I explained the situation. قلت له here's the things, I have an elective abroad وما أدري إيش, وإنه I cannot إنه I'm gonna be delayed for 2 weeks, and يعني he let me يعني واشتغلت معه هو he knows me اشتغلت معه I think I took it from the OB-GYN rotation اشتغلت معه and he knows me and he was okay he said as long as the rotation is covered he's okay so one of my friends she helped me out actually she covered for me so you can always find ways just ask I think you just be internship is very flexible here inshallah you will do يعني you'll do just fine. And then we have Sajal Gahtani. Is it possible to take elective at the start of the internship or it may affect the SMLE? So for me, أنا from track B, KSU track B. So I أخذت أول شيء أخذنا pediatrics and then ER and then I started my rotations. During the ER rotations, I took one exam and then the second exam أخذته بعد December. I was doing neurosurgery. بس my exam من البداية كانت درجة كويسة بعدين يعني ما درست بعدها ما درست أكثر من الدراسة اللي قبلها أخذتها مرة ثانية درجتي صارت أحسن بس إني ما درست يعني during the rotations اللي أخذتها في neurosurgery I don't remember إنه I studied very well I didn't really have that time so I encourage you honestly إنك تاخذي and to finish your SMLE before diving into your electives لأن electives will take يعني will consume a lot of your time because يعني you're there يعني to actually learn and impress. So yeah, it's better to take your SMLE before your neurosurgery rotations. Then we have Shuruq who says how many seats are available in KSA. I'm not really sure about the Jeddah and the Dammam, but هنا في السعودية usually زي ما قلت sorry هنا في الرياض usually زي ما قلت لك they have to 6 to 8 seats are available each year. And then we have Khulud, when to start taking summer electives. صراحة there is no thing such as when. I remember في على دفعتي there was a lot of students who were extremely interested in their surgery and they started really early from third year. And for me, I didn't really start like my passion and everything up till my fifth year. And at the end, some of them actually drift and dived away from neurosurgery, went to تخصصات ثانية. أنا for me, يعني I'm like already neurosurgery residence. I think it depends. يعني don't say it's يعني don't say oh it's too late for me to take summer electives. So في نفس الوقت, like if you're interested from an early on, you can take electives. Maybe like if you take electives, you would know that this is خلاص, this is not the specialty for me. So you exclude it and then you focus into other specialty. And then we have Adi Abdulaziz, how to increase your chances as a student from peripheral regions with little connections. أنت Abdi Abdulaziz. I think that our neurosurgical network حتساعدك مرة كثير. I don't know إذا عندكم in your like peripheral regions if you have like إذا عندك مثلا a hospital that has a neurosurgeon or not, but please just contact me وإن شاء الله I'll help you out. I'll help you out in this. طبعا during your internship يعني one thing to do during your internship if you can just come يعني اطلع من المكان اللي أنت فيه وروح مثلا to جدة أو دمام روح to أو تعال من الرياض to take some electives. And when you come like لما الناس يجوا يسألك مين أنت وما أدري إيش just let them know إنه أنا ترى from peripheral regions بس I'm extremely interested in neurosurgery. The one thing to do. The other thing is to do research. وطبعا النتورك حقتنا بتكون very typical very كويسة for you. So just contact me وقول لي أنا ذكرني سؤالك. So we have Sultan. Was the elective outside of Saudi Arabia very helpful regarding the CV? Elective outside يعني just one thing about me أنا من الناس اللي I wanted to go to Canadian programs بس على سنتي حصلت the issues حقت كندا they had to stop like the admissions and everything. At that time I said okay and I was accepted يعني at that time I was already accepted in local program as a backup plan. I gave myself 1 year just to explore the program ومرة عجبني honestly. يعني I could never imagine myself in any other place. فعشان كذا أنا خلاص يعني شلت سالفة كندا from my mind. ف to me الروتيشنز اللي أخذتها في كل مقابلة كل أحد سألني عنها like في الريجن فهنا في المقابلات هنا حقت الرياض كل أحد سألني عنها إنه you took many electives outside. هل أنت رايحة برا يعني هل أنت ناوية تروحي برا which is actually it's a red flag when a student comes ومعاه كذا كثير electives برا it's kind of give them like إنه يعني كلها سنة سنتين بس I'll يعني I'll improve my CV and then I'll leave the program to go out abroad. it's good and bad. I don't know صراحة بعض institutes they were okay with it بالعكس it was a good thing. بعض institutes no بالعكس حجروا لي في المقابلات على أساس إني طلعت برا كثير. And then بس يعني as for yourself honestly I learned so much because برا يعني they actually يعني يعطوا وجه للstudents and interns. يعني for me أتذكر في Dalhousie one of the cases I was able يعني I scrubbed in alone with one of the consultants and she let me close up the door which is way beyond my level. بس يعني that's something to consider إنه برا they will give you more surgical exposure as an intern and as a student than here. So we have Abdulaziz. I am passionate about neurosurgery, but the load of the work withhold me from choosing it. Should I pursue or choose another specialty? And this is يعني this سؤالك هذا يعني يبين the importance of taking on calls as an intern. What I advise you, I'm not really sure either you are a student or an intern, but what I advise you إذا أخذت elective neurosurgery, try to take an on call. وطبعا during your on call stick to the residents like قول للresidents اللي on call قول أنا بجلس معاك يعني حتى لو تقعد معاه في الغرفة حقت on call like تنام معاه and everything in the same room لأنك يعني this exposure will let you know about يعني the load the load or the lifestyle of the neurosurgery. فهذا الشيء مرة يساعدك إن شاء الله. فعلى طول take electives, take on calls and you will know whether the load يعني حتتحمله ولا لا. بس عادي يعني don't be لا تحس إنه because I'm thinking this way معناتها neurosurgery is not for me. لا أنا I was there in your place وحتى يعني نفس الشيء يعني I had some doubts. بعدين we have أحمد المكارمي. Which is your advice when choose city in applications? Because others say choose large city, they have large number of residents. احنا عندنا هنا في الرياض السنة هذه we have the largest number of residents which is 46 لا sorry it's I think it's 65 it's 65 which is the largest number طبعا وعدد الحالات قل comparing to the last year. I'm not really sure صراحة what are the actions that they will take to actually reduce the numbers. I heard honestly إنه الدمام like the eastern side إنه they have less residents so they have more surgical exposures. I don't know honestly. Maybe they're better than us in terms of this. I don't know honestly. And we don't have really some statistics. And صراحة I offered like the regional program director to actually conduct some statistics على logbook since we have logbooks that is كل residents have a logbook. But maybe إن شاء الله بعدين later on we can do the comparison. Maybe we do نعد الحالات ونشوف we do a comparison. Then we have Wissam. How can I find neurosurgery research opportunity in my last year of medical school? Okay, so I like أحب أساعد the students and the interns in terms of research, and this is why I actually established this research network. So just contact me أنا بساعدك إن شاء الله. We have, but this is the phone number. Are there job opportunities and do these surgeries have good results? If you're talking about job opportunities in terms of you are a local program graduates, I would say one of the advantages of going abroad, when you go abroad, they will give you a scholarship, and being given a scholarship, that by itself is a job security. خلاص هترجع and you would be a consultant in this hospital اللي actually أعطاك scholarship. بس هنا عندنا في local program, once you finish that, you have to actually go and find job opportunities. طبعا the number of طبعا في article I can send it to you if you just text me وقول لي إنك أنت سألت هذا السؤال. I'll send you an article which is published by Dr. Abdulrahman Sabbagh about how many neurosurgeons here في السعودية. فواحدة من الأشياء و they have an index about يعني هل the number of the neurosurgeons is adequate ولا لا. طبعا they took يعني in each cities how many neurosurgeons وبعدين شافوا الانdex. هنا في الرياض we have more than adequate يعني we have abundance of neurosurgeons. في some regions لا زي جدة. فالjob opportunities تختلف from city to city, but I can send you this article حق دكتور صباغ and you can know which cities actually have more job opportunities. And then you said, do these surgeries have good results? No, not most of them. That's why I told you, neurosurgery is not يعني من التخصصات اللي that is very satisfactory, and you will face a lot of neurological deficits وهذه الأشياء, which is something that you have to take in mind actually before going into neurosurgery. So next we have Khalid for students who want to do research, but the neurosurgical background is not enough. What is your advice? Actually, you don't have any عادي. You can start any neurosurgical research with having zero background. Like you can just do your literature review and everything, and then you can learn. Like you can learn, and you don't consider having no neurosurgical background as setbacks. It's okay. You can learn. And you can تجي with someone who has a neurosurgical background, but when you learn and learn and learn, maybe you learn better than someone who already has a neurosurgical background. So بالعكس يعني you have to develop a growth mindset. بالعكس يعني this should not be a setback. And I encourage you. عارف مكتوب خالد ليش double L? I don't know. It's Khalid, I think. I expect you to contact me على أساس أنا أساعدك إذا تبغى. How about patient's satisfaction? والله satisfaction depends on the surgical outcome. So if you have a good surgical outcome, patients will be satisfied. If not, يعني the patients will not be satisfied, and you are not going to be satisfied, which is something to consider. I encourage you if you're talking about مثلا surgical outcome, patient satisfaction, في كتاب اسمه Do No Harm by a neurosurgeon, written by a neurosurgeon, and he speaks about this part and how to live up يعني with the neurological deficits, post-neurological deficits. It's an excellent book if you want to read it. But then we have Mohannet, how I find a mentor. Actually, لما تاخذ electives and you do some researches, some people and some neurosurgeons will be more engaged to you. You can just يعني consider them as your mentor. If you think they're trustworthy, if you can just send them, and you can just ask them frankly, I consider you as my mentor. Can you just مثلا look up into my CV, help me out in that and this and that. That's it. يعني just network, and once you work closely with the neurosurgeons that you think is trustworthy, he will help you, and he can be your mentor. And then we have Noura. How much does the GBA matter? Well, it depends honestly. In GBA, it's part. I think it's part of the components. حقة الماتشنج, حقة الهيئة. That's number one. Number two, in the CV, I think يعني في المقابلات they will read about your GBA. بس يعني generally, if you have a good GBA, you have honors, I think it's يعني it will help out, but it's not very a crucial component of the everything. But then we have Zahra, how to take a sponsored scholarship from a hospital. Actually, كل hospital they have some certain announcements. زي KSUMSC they usually announce from the scholarship department حقتهم. هنا احنا عندنا في الجامعي they're fully saturated with demonstrators. National Guard, I think they still have some scholarship. You can just go to National Guard scholarships, ask about it. عندنا إيش كمان scholarship. ممكن وزارة التعليم أحسن شيء إنها ما تربطك في one hospital. They can give you a scholarship, you go pursue your residency abroad and then come back من غير sponsored hospital. But it's okay يعني. That's it. في any other questions? محمد أنا قاعد أشوف dismissed.
Thank you so much, Dr. Hassan. Thank you everyone for attending this lecture.
أنا ما أسمعكم I think that's I think خلص الوقت. I think إنه I answered most of the questions. If you have any other questions, do not hesitate to contact me. My email, WhatsApp, Twitter, and good luck. يا رب. توفيق جميعا إن شاء الله. مع السلامة.
Thank you all for attending. بإذن الله الآن دكتور منصور يدخل ونبدأ ال Residency in Neurosurgery in the US.